grant proposal was to put an end to overdosing. So our plan for the future is a substance abuse program that will be designed specifically to limit the amount of overdoses that will be available through the Center for Disease Control and the National Institute on Drug Abuse. This is unlike your typical substance abuse program that are currently available. So our treatment plan starts with a methodology in which trains individuals how to work with these patients, working one-on-one in efforts to becoming sober. The next step after making these facilities and workers to work at these trainings would be to put counselors and educators inside classrooms that teach students to not go down the same path as substance abusers. These paths will be negative in their lives. The counselors will also work one-on-one with students who have families or friends they know that are involved with drug abuse. When working with the treatment facilities, pharmacists, medical professionals, and law enforcement will take action on the streets, removing the hazardous drugs out of availability to the people who are using the substances illegally. Some ways to dispose of unused drugs would be through this program, as the pharmacists and law enforcement collect them. However, there's also current programs of unused drugs that are being collected. There are also ways to dispose of your drugs correctly, using the example followed in this picture. Mix with unappealing substance, place in a sealed container, throw away, and scratch out personal information on medicine bottles. This will ensure that nobody is digging through unknown substances to get these drugs. Some of the goals is to organize groups to inform people about these organizations that collect these unused prescription drugs in order to prevent individuals from consuming these drugs that they were not prescribed, so that way they can't overdose because they do not know what is in these drugs and what the appropriate amounts to consume are. Our second goal is to have the number of overdoses per year to decrease by half through the education, the formation of our rehab facilities, and the one-on-one care that is offered to these individuals. Overall, the goal is to have the number of overdoses decrease through our use of our proposal. Some of the objectives would be numerical statistics that we want to decrease our numbers by. So for our first objective is 50% of the patients will seek help to become sober through the help of our treatment facilities and the one-on-one care we will receive throughout the process. This also includes care from their families as well as these one-on-one counselors at these facilities. Our second objective is the number of overdose deaths will decrease by 50% in the next year after our facilities have been used through the use of this treatment, education, and collection program of the unused prescriptions. Our third and final objective is to have less than 20 states in the United States to have statistically significant amount of overdose deaths through the implication of our proposal. Currently, there's over 29 states who have statistically significant amounts of overdose deaths, which would bring it down by approximately 10 states with our proposal. So our major impact is hopefully that the program will decrease the amount of overdoses in the United States and teach the future generations to not follow down the same paths as these individuals. The money used from treating overdoses currently will decrease because less people will have overdoses. Therefore, the money saved will go into supporting our program and preventing overdoses from even occurring. The law enforcement will also have less responses to overdose cases, in which they can focus on more violence and other situations that are happening in current society. So our overall evaluation is step by step. So step one is to create the treatment facilities and begin the training employees before anything else has been done. That way they can seek the one-on-one care they need sooner. Step two is to implement the education aspect, where counselors and educators are trained to teach students about substance abuse, therefore they don't fall down the same footsteps, and therefore we save money on future costs towards overdoses. Step three is the next step is to send out these pharmacists and law enforcement to retrieve the unused and dangerous drugs of prescriptions off the streets, which includes collecting these prescriptions so they don't end up in the wrong hands and people don't end up making their own business off selling these unused prescriptions. Some of the next steps after this would be to organize and inform people about these organizations that collect unused prescription drugs That way they know when they have unused drugs, they send these drugs to these organizations. When looking at patients' history and seeing if they have returned to substance abuse after the program, we will see if our program was successful or not based on the first few people who cycle through our program. If they return, then we will look, if they return to substance abuse, we will look at new ways to modify our program. If they begin to look back, we will modify our programs to ensure that their abuse doesn't happen again.